If untreated, an enlarged prostate can cause lots of problems, and unfortunately, many men ignore the issue until things turn dire. Meg Judy has more about a new laser surgery that can help correct an enlarged prostate.
To Mel Bremer, the clang of metal on metal sounds like success.
I was born and raised a horseshoe pitcher. My dad was a horseshoe pitcher, and I've just loved the game my whole life.
The game is how Mel, who turned 75 this year, stays young. But he nearly had to give it up after his health declined dramatically in 2024. Mel started having urinary problems, including an episode where he couldn't urinate at all. He needed a catheter and additional treatment because he couldn't sleep, was at risk of kidney disease, and felt miserable.
Over the course of about 3 or 4 months, it really blew up. So I went to my urologist here, and he said, you really are going to have your prostate removed.
For a lot of men, trouble urinating may seem like a normal part of aging, but it's not, and it can be a serious issue, particularly if it's interrupting your sleep or daily life.
I think a lot of guys are embarrassed to talk about it. I think that's why a lot of guys don't come in until it's gone on for many, many years.
Mel had benign prostate growth, or BPH, which puts pressure on the bladder and urethra. The condition can block urine flow or decrease the size of the bladder.
I do see a lot of men, unfortunately, that have been dealing with urinary issues for 20, 30 years. And I think have been needlessly suffering for a very long time.
Mel came to MU Healthcare and Dr. Al because of a new minimally invasive surgery called HoLEP to remove prostate tissue. It has less risk of bleeding than other surgeries, an important fact because Mel takes blood thinners.
I needed to have this done. This did not have an incision, with it. Makes you feel very confident.
MU Healthcare is the region's only health system to offer HoLEP.
HoLEP was kind of a win-win-win for him. It really checked a lot of boxes. I think hopefully solved his urinary problems for the rest of his life.
The procedure took a few hours, and Mel went home the next day without restrictions. Even better, no pain.
I just felt really pretty darn good from the moment I went home. I've had more pain with the tooth cleaning than I had with this procedure. It's a miracle.
Waiting for him at home were his two loves, family and horseshoes.
Trying to get back where I was and compete for a championship. I don't have anything standing in my way right now.
To learn more about treatment options for an enlarged prostate, visit muhealth.org/prostate relief. For KY3 News, I'm Meg Judy.